first, as a virologist who looks at how we're handling all of this, even as a Nigerian who doesn't want to contract this, what will your observations be, having seen what goes on at the borders there?
I think we need to do much better than that. In countries that have, again, in the East African countries that have controlled, there are what we call sanitary borders. And the sanitary borders have been well kept, sometimes with military people to check and ensure that whoever comes in is checked. As it is there as well, we saw the, I mean, they were looking at 3 or 4 people, 600 people were going by scooter in and out. So I think it looks like a joke to me. I'm sorry to say.
It's a town. I mean, it would seem that we have a problem on our hands, because it would seem that Seme border itself is now in a town.
Exactly.
And you cannot say that activities will not go around that town. It's like people know this is the line between Benin and Nigeria, but around that is a very vibrant town. Do we really have a hope of setting a very clear demarcation and saying, no, if you're going to pass here to here, you must undergo a check?
In a time of national emergency, I mean, you have no choice but to do that. It may inconvenience people for some time, but the inconvenience of not doing that could be fatal. And therefore, when issues that I keep talking about discipline, when issues like this arise and there are needs for national emergencies, you just have to abide by them. I know it's going to cause inconvenience, trade and all those kind of things, but what's a dead trader when Ebola kills him? So we need to, and how does it become also affecting other people? When you look at the economic impact of Ebola on a country, you know that keeping that border strictly, sanitary border completely, is something that we need to do. And as I said, there have been inconvenience for people, but it's only temporary until we solve the problem of Ebola. If we don't, it could even go worse than that. So countries go into a state of emergency, and you have to abide by rules of the emergency. But I don't think we read that level yet.
But, you know, it's gladdening. I mean, when we read, for instance, 1 more Nigerian patient is due to be discharged. We have discharged some others. In spite of all that argument and confusion about what the cure is or would be, whether or not we're going to get it anytime soon. But tell us about this ZMapp. Now, there's some commentary we read in the paper that the much sought after ZMapp, I mean, look at that headline. It fails to cure the Liberian doctor. And then there was that one in Spain that didn't survive. So what's the connection? Is there any direct link for those who recover having used ZMapp?
I think a lot of things depend on the drug. First of all, how early you begin the treatment. We know, for example, if you give ribavirin to Lassa patients in the last stages of their life, they actually will die. You hasten death, because the liver and other organs of the body are already compromised. And many of these drugs need to be detoxified. And if your liver is already gone and you're giving him a drug, then you're actually overloading the liver. And in process, the person will probably have a rapid death. So early detection, early institution of early treatment is actually what makes a lot of difference in many of these cases. I don't know about this case, how soon they started it, but you also notice the 2 Americans, although they too were sick for some time, but one of them were told immediately they got the ZMapp, they had it almost instantaneously, 20, 30 minutes later, it started becoming this. So first, it depends on the individual. How do I react? What is the state of my health? What stage of the disease do you give me the ZMapp? All those are factors that are taken into consideration. In any case, we've been told ZMapp has not really been tested experimentally, proven. I mean, don't know the stages of test for human use. Whatever result we're getting, because it's not controlled, you're bringing in people at different stages of disease. You're not starting with everybody at the same time. So you cannot use this one to say ZMapp is not working. On this occasion, yes, it didn't work. But experimentally, you have to follow what we call controlled study to be able to know whether ZMapp is working or is not working. So we've got some successes and we have some failures. But again, many factors could be responsible for that.
I know you alluded to this somewhat in terms of why we're not getting the kind of result we should. But tell us a lot more in terms of why is it difficult for us to develop a cure here? We know that, look, we know about this in Africa for some time now, but lots of people are asking, despite the fantastic scientists we have in this country, we still cannot develop a cure.
there's something about an enabling environment. You can be the best of scientists. You can bring the Nobel Prize winner into our country, and he starts experiment, and NEPA fails. There's no way he's going to be winning any Nobel Prize. These are some of the issues I think we need to look at. One of our former ministers, Professor Oyewale Tomori, wrote a book, Running Before You Can Walk. I think if you remember that, because of the space thing we're doing. And he said there was need that we're dreaming of having a Nigerian in space by 2015. And I then remember telling him that if we're going to run, every part of our body must run. You can't have the brain running with a lame leg. It's not possible. Your brain can be running sharp, but if you're lame, there's nothing you can do. So every aspect of our life, in fact, what I used in telling him was the fact that would you like your son to be that astronaut in 2015, when at the base is dependent on NEPA, and the communication is dependent on MTN. I'm sorry to use the word MTN, but the kind of communication we have in this country. Will you want your son to be in space for that 5-10 minutes when there be a break in communication or where power failure will be? So the enabling environment must be there. It's not that our colleagues who go out into other parts of the world where people appreciate what it is, they excel. But you can't excel above your environment. Your environment either drags you down or lifts you up. And I think the Nigerian environment drags down excellence. I'm sorry to say, but that's the truth. And until we begin to appreciate that it's every aspect of our life. I was a vice chancellor for 7 years. I was spending 15 million on diesel every month to supply power for 8 hours. Is that the kind of thing you're looking for? That's not the kind of life we're looking for. Those issues need to be addressed. When we say Nigerian universities are not among the best, whatever, what do they use in determining? There's something they call country perception. When your country perception is down at the bottom, and Ghana is here, even if your university is better than Ghana, your country perception has brought you down. These are issues that we need to look at. It's a
total picture.
It's a total picture. It's not just the scientist. It is the environment. It is the thing that is doing. So it's not that we don't have people who could have discovered the cure of Ebola, but the environment will not allow them to do that. And in any case, when you look at in 1995, when we finished at the Ebola conference, money was raised, about $2 million was raised. Nakajima was the DG then, Director General of W.H.O. And we all sat down and were discussing what do we do with this money. In Zaire at that time, there was a lab which was built almost complete, 98% complete. And I then suggested, look, can we take part of this money to complete this? Then Africa will have a lab where we can have this in. Of course, nobody listened to an African scientist. And I remember part of the money we used there was to hold a meeting in Antwerp where we all called in to come at that time. And I did predict at that time, 10, 20 years from now, when Ebola comes into any African country, we will still call you back to come and help us. Is that not what is happening now? All of the people who have been in the African, foreign CDC is here, MSF is here, although our people are doing well, but can we do it alone without them? CDC is just giving us, or US government just giving us something to at the airport. Can we not do some of those things? For each jet that we have in Abuja, we could improve some of the things we're doing. These are the issues that we need to be discussing.
But do you think that, from what you've seen, are we optimistic that we could get this BSL level 4 facility in this country?
With the current situation, I won't work in such a lab because my life is not, I cannot guarantee my life. Until we improve all those other basic issues I'm talking about, don't think about BSL 4 in this country. You're going to create danger for everybody.
How would that be?
That is, your electricity is stable, your water supply is okay, and when people's attitude to what they're doing, they're determined, they're ready to work, it's a whole chain. It's not just the head of state that should do what is right. The man at the gate should do what is right. If when I was coming into this place here, that guy had not given me to sign, anybody could have come in. So everybody has a role to play. We just finished a national conference. We were saying all the time. I said, look, it's new wine in old bottles because we have not changed our attitude. No matter what you do with the new thing that is coming out of this, if our attitude remains the same, forget it. It's going to same the whole story. We have to start first with ourselves. That change must come from the individual in this country. Must make up his mind that I want to do what is excellent, what is right for this country. And if we all agree to that one, then we're ready. I just time when I could say I was ready to die for this country. Not now. I want to live for this country, not die for it. Because there are many, many things that this is not the kind of country I want to die for. I think these are issues that we need to look at. in every aspect of our life that we do. Excellence, that integrity must be more. So whether you want to be a BSL for here, if you don't address those things, you're going to be a BSL of death for those who are working in there.
So we have to refocus, because in spite of the challenges, if we've been able to handle it this way, so you can imagine what happens if we not put some of these other measures in place.
I think what this shows us is that we are capable. We're able to do it. We have the people and the resources to do it, but enable them. The lab they're using, the Central Public Health Lab in Yaba, which is where the EOC is, it's been on for the last, I don't know how many, 20, 30 years. We have been allocating money to refurbish the place, until Ebola came, when I think Dangote gave some money. And of course, because the whole world is watching us, within a week, go and look at that place, it's different. It's the same government that allocated money in 1995, 96, all the year for the last 10 years, and nothing happened there because somebody somewhere, the money that is allocated is not being used for what it should be used for. Now we have to account for it because the whole world is watching us. So if we have that attitude, this country can be what we want it to be. It depends on you, it depends on me to make up our mind that this country should be what it is. Excellence, integrity, determination, patriotism. These are issues that we need to look at for our country.
And as you say, it's in our hands now.
It is in our hands, yes.
All right, Professor Oyewale Tomori is the Regional Virologist for the World Health Organization. He's a former Vice Chancellor, Redeemer University. He's also the President, Nigerian Academy of Science. Thank you for coming on this morning, Prof.
It's a pleasure. Thank you.
Well, we'll be back after this break. Join us again.